the holiday weekend here. How do we enjoy it safely? For that and the latest coronavirus numbers, we're joined by Dr. Amesh Adalja, Senior Scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, good morning. First off, state health department officials are urging Americans to stay at home this holiday weekend, but a lot of folks already have their plans. So what's the message? What's the message to those who will certainly be out celebrating this holiday?
The message is that every time you take any activity in the era of the pandemic, there's always going to be some risk of either you transmitting or acquiring this virus. And that doesn't mean you have to stay at home and not do anything. It just means that you cannot act as if we're not in a pandemic. You need to try and follow as much as possible social distancing rules, washing your hands a lot, not touching your face, wearing face coverings as needed in order to minimize that risk of you acquiring it or spreading the virus to someone. And this is the new normal going forward until there is a vaccine. So we have to get used to living in this type of era where there is this risk every time we step out the door.
A majority of states are seeing an increase in cases, certain areas significantly. Some states are also seeing a rise in hospitalizations. What do you expect the month of July to look like?
It's probably going to look just as it looked at in late June, meaning that we're going to see more cases, we're going to see more hotspots pop up, and the key question will be, will we see hospitals getting under stress? And I think that's what we have to keep in mind, and that's what we're trying to avoid, is some kind of a repeat of what happened in the early days of this pandemic, where we were worried about personal protective equipment, mechanical ventilators. We haven't heard so much about that, but there are some hospitals in Arizona, for example, in Houston and Florida, where we are thinking about how are they going to sustain this surge of patients. And I think that's what we have to keep in mind, is that we know we're going to get cases. We just have to keep them to a level that's manageable by the health departments and hospitals through contact tracing, so we don't go into this kind of crisis mode again.
Doctor, we've seen a number of states implement some form of mandatory mask wearing in public. Do you believe all states should implement that?
Right now, we have many people out there that have very mild symptoms or maybe no symptoms at all, and they might be contagious. And what a face covering can do is decrease the source, it actually serves as source control so that you're less likely to spread it. So I do think while we have all of these people out there, it makes sense to take this simple measure in order to stop transmission from occurring. And it doesn't necessarily have to be a mask. It could be a face shield as well. So I think that there are a couple of options here. But I do think now that the consensus is that this is one way to decrease the spread, because there's so many people that don't even realize that they're infected that are out there.
I also want to ask you, Doctor, you've recently written about the need for at-home diagnostic testing. Why is that important for right now and also in the future?
Well, we've had this whole pandemic really be marred by testing failure after testing failure, and we're still talking about testing even though now we're doing 600,000 tests per day. Home diagnostic testing is a way to really empower patients to be able to test themselves, and it would alleviate lines at testing centers. It's a whole new paradigm of thinking about how we might manage infectious disease emergencies in the future. And we do this for HIV, and there is technology for influenza out there, and it could easily be adapted to coronaviruses. And there is a lot of political will now, so I think we could call on some of Congress and funders to try and push this type of technology forward, because it will be something that would change the way we think about pandemics, give us so much more awareness of what viruses are out there, and I think it would really empower patients to take their health into their own hands.
Okay, interesting to hear about that. The question, I guess, is how long it would take. Dr. Amesh Adalja, thank you very much for your time.
Thank you.